everybody, and welcome back to my channel. On my way to the doctor, got 2 doctor's appointments today, so I figure I will come on and update you with what's been going on. I have my doctor's appointment with Dr. Henry today, which is my oncologist surgeon, and I had an appointment with my doctor, Dr. Lee, who is my reconstructive surgeon. Based off of the last video that I made, that was my surgery video. That was on November the 7th. And I'm pretty much almost healed from the surgery as of right now. And going there to let them check my incisions and everything like that. So I'm excited and happy about the results that I got from the surgery and just looking forward to healing. So I don't know if I updated you guys with what's going on with my diagnosis. Got all of my tests back from the biopsy and everything looks good. No more cancer. So I am definitely excited about that news. Now it's just a matter of them confirming in my lymph nodes what is left. So they are wanting to do another surgery to test the other lymph nodes that they left to see if there is any other cancer that exists in those lymph nodes. So not happy about that, but I'm praying that all is going to be well. So I'm not worried about that. And then after that comes radiation, because they want to make sure that there is nothing else left and nothing else that's going to come back. So still a little bit to go, still on the journey, still got some things that I gotta do, but I know all is well. Y'all see my hair growing back. I'm happy about that. I want to pretty much keep it like this because I don't want all that hair on my head no more. I don't got used to being scalped pretty much. So I am happy about what is happening, how I'm progressing, and I know all is going to be well. God is bringing me through, and I thank Him for it. So, y'all, Apostle taking me to the doctor, y'all. What's up? The book? Oh, Main Street Renewal? Yeah. But anywho, I will talk to you all later. Please like, comment, and subscribe if you haven't already. Prophet, you want to say hey to the people?
Hello.
Can you say hello, y'all? And I will be back to update you as soon as I can. Hopefully, I can maybe record Dr. Henry so that we can learn together what's going on with them wanting to do these extra surgeries. But we'll see. I will talk to you all later. Bye. Love you.
All right. Perfect.
They were talking about additional surgery.
I'm going to show you.
Okay.
I'm going to show you the results from that. Because I feel like I'm the last person for you to see. Everyone saw you already.
Except Dr. Lee, he's probably cussing right by now.
Oh, Dr. Lee. So the way they do it in his office is that you see him before surgery, and then usually they wait like a month. So you go back and see like the people in the office like once a week, once every 2 weeks, and then like usually at like a month or so is when you'll see him again. Yeah. Everything been going okay though with your visit over there?
Mm-hmm.
Oh, okay. Alright. So lymph nodes. So when we did the surgery, it was just like really kind of scarred in when I was taking the lymph nodes out. Yeah. And so, at that time I didn't know if it meant there was still cancer there or if it was just a reaction to the treatment. Mm-hmm. And so it was meant to be 1 lymph node, but there actually ended up being 5, and 3 out of the 5 still had some cancer in it. Okay. But that's still much better than what things looked like when we started. Right. But if there's even just like one little tiny bit of cancer left, then We want to get rid of that.
Right.
So the good news is that this is out of you, right?
Right.
This is what I've already removed. So the other good news is that we didn't find any cancer left in the breast.
Right.
So that part's excellent. I took out 6 pieces. That was what I took out. So I took out the main lumpectomy part, and then I took out a little bit all around that, and that was all benign.
Okay.
Dr. Lee took out some more, that was benign too, and then he took out some tissue from the left side, and that was benign.
Okay.
So in the breast, there was no more cancer left, but in the lymph nodes, there was. Okay? So whenever someone still has cancer in the lymph nodes after chemo, then we want to remove all of the lymph nodes. And so my recommendation would be that we go back and remove the rest of the lymph nodes underneath the arm.
Okay, what are we looking like as far as recovery time?
So recovery from that should be, probably about 2 or so weeks. You'll have a drain. That'll usually be in for about 2 weeks. And then, with the surgery, you already have a little bit of numbness that might be just a little bit more, because this is where all that numbness comes from, the nerves that underneath the arm.
Right.
And then the biggest thing that we worry about when we take out all the lymph nodes is lymphedema, right? And so we try to coordinate that surgery with Dr. Lee, so that once I take out the lymph nodes, that he can go back behind me and put together the connections to help improve the drainage after the lymph nodes are gone.
Let me ask you a question.
Yeah.
The sleeve that I'll be
Mhm.
fitted with,
Would it be a permanent sleeve or?
No, you just wear it like, if you have symptoms. So everybody that gets a surgery doesn't have lymphedema. Some therapists like to give patients a sleeve regardless, that you wear whenever you fly or, that kind of thing. And then some therapists will just only fit you for the sleeve if you start to have lymphedema.